Minnesota's climate has changed and is continuing to change. Minnesota's average daily temperature has increased substantially in the last century, and the rate of change has increased dramatically in the last 50 years. Minnesota is the third fastest warming state in the United States, and precipitation in the state has become more erratic and extreme, with more numerous heavy storm and flooding events separated by longer intervening dry spells. This change in the climate is having a major impact on the environment in which we live. But many people don't realize that it's also affecting our health. Increases in heat-related conditions, infectious diseases, and psychological stresses are just a few of the health impacts that we are seeing related to climate change. In fact, climate change has been identified as one of the major public health challenges of this century. Because of that, we will be talking about climate change and its public health ramifications on today's episode of A Public Health Journal. Please stay tuned.
Welcome to A Public Health Journal, a program that explores public health issues facing our society today and tomorrow. The host of the show is Dr. Ed Ellinger, Commissioner of Health for the state of Minnesota. A Public Health Journal is sponsored by the Minnesota Department of Health and the Hennepin County Human Services and Public Health Department, all working together towards the goal of healthy people living in healthy communities.
Welcome to A Public Health Journal. Today we'll be looking at the issue of climate change and its impact on public health. We'll be discussing the changes that have occurred in our climate and the impact these changes are having on our state. In particular, we'll be focusing on the impact of climate change on human health. Joining me in this conversation is Dr. Mark Seeley, climatologist and professor in the Department of Soil, Water, and Climate at the University of Minnesota, and Kristin Raab, director of the Minnesota Climate and Health Program at the Minnesota Department of Health. Dr. Seeley is well known for his long-standing and varied efforts to educate Minnesotans about the impacts of weather and its climate on Minnesota's agriculture, transportation, energy, tourism, and natural resources. And Ms. Raab is an emerging leader and expert on the issue of climate change and health. Dr. Seeley, Kristin, welcome to our program.
Happy to be with you.
And this is an issue that, and I'm wearing my climate change tie because this is a huge public health issue that most people don't recognize as a public health issue. So I want to start with you, Mark, talk about what is climate change and how is it different than the weather that we experience so that people can understand sort of what we're talking about, that it's a big picture kind of thing.
Oh, sure. Well, of course, we all pay careful attention to the weather in our region of the country because it's so important in our day-to-day lives. Weather is what's happening now. It's what's dominant in terms of the environmental conditions outside. If there's a frontal passage, a change in air mass, if there's precipitation occurring, etc. What's going on here and now and in the short term, the next few hours or the next day or so. The climate is the long-term measure of everything about weather, including the averages of temperature, pressure, humidity, precipitation, etc. Kept by the way, a network of wonderful volunteers that we have over 1,500 volunteer observers of daily weather in the state of Minnesota. Mm-hmm. And so it's those long-term averages that we worry about in the context of climate change because we have a rich history of climate measurements in Minnesota that go back to the mid-19th century. And in those measurements, we're seeing a pace or rate of change in many of our climate attributes that is extraordinary and outside the range of any measured pace of change in our state records.
All right. I've got a couple of slides. Let's look at the first slide, which looks at the Minnesota average minimum temperatures and how things have changed. And you can see on the slide that it's really moved north in terms of the average minimum. We're getting warmer and warmer for our minimum temperature.
That's right. The geography in terms of our temperature distributions has changed markedly. We've seen a migration north in terms of warmer temperatures, particularly warmer nighttime temperatures. In terms of the growing season for our agricultural production systems, we've seen a migration north with longer growing seasons dominating up in central and northern Minnesota. We've changed in terms of landscaping. In fact, the kinds of plants that you can use to landscape in Minnesota has changed in that our climate has changed enough. It's now more suitable for plants that would have been more seen in the southern latitudes. And so all of that is manifested in that migration north of the warm temperatures. Also the pace of change, decade by decade, as we've stepped through time, we've seen the rate of change in our average temperatures actually accelerate.
So I do have a slide on that. Let's take a look at the second slide,
Right.
which really shows that in the first part of the, the last 50 years, things have increased dramatically.
That's right, and we're not alone in that. We're not alone in showing the pace of change accelerating. Many of the mid-latitude climates on the continents, including us here in the middle of North America, but in Asia and Europe as well, they're showing this same acceleration of temperature change that has occurred over the last 2 to 3 decades.
So the data are pretty powerful that we are experiencing something that is unusual and unique.
We think it presents a powerful argument because we don't see anything like it in the historical measurement record.
Right. And Kristin, from the health side, what do you worry about when you think about these increasing temperatures in our society?
Yeah.
What are the public health implications of rising temperatures?
Right. So in addition to the fact that just our average temperature is rising, we're also seeing more extreme heat events. And so extreme heat events have consequences for public health. There can be illnesses, heat-related illnesses like cramps, rashes, minor kinds of illnesses, all the way to heat stroke and potentially deaths. So we have a great example here in Minnesota. In 2011, we had an extreme heat event, and there were 1,255 emergency department visits due to heat. And so with that increasing amount of extreme heat events, we're going to see more heat-related illnesses. And sometimes people think, oh, it's Minnesota, it's colder here. But in Chicago in 1995, they had over 700 deaths due to heat over a 5-day period. So we're really, really concerned about this increase in heat.
Yeah, and we have a slide here that really shows the fatalities, weather-related fatalities, and you can see when it gets on the screen, you'll be able to see that the heat is the #1 cause of.
It is the highest 10-year average of deaths due to a weather-related event. So that includes hurricanes, it includes floods, things that we think about when we think about extreme weather. We don't typically think about heat. It's considered like the silent killer because it doesn't make the news like some of these other events. But it has the highest 10-year running average, and so we're really, really concerned about that, especially in Minnesota.
All right. Well, I'm going to talk also about the moisture, the precipitation. We've talked about heat, but first, before we get to that, I need to take a little break. So we'll be back right after this message.
Our climate really is changing. It's getting shakier, more severe, and more chaotic. We're talking storms, heat waves, and floods. Of course, we've all heard the stories of melting ice caps and rising sea levels, but sometimes, here in Minnesota, it can be hard to understand why we even care. After all, there aren't a lot of oceans or polar bears in this part of the world. But it turns out you don't need to travel all the way to the Arctic to discover how climate change is affecting your health right here at home. Raise your hand if you breathe. I know, silly question. We all breathe. But did you know, in this new roller coaster climate we're living in, longer growing seasons are producing more pollen, and this is something asthma and allergy sufferers are already noticing. How about eating? Who eats? Well, it turns out heavy rains, followed by severe droughts, are very hard on crops. It's almost like watering a plant just once with a fire hose, and then never again. It's not ideal. How about going outside? If you like the outdoors, things get really complicated. You see, thanks to our wimpy winters, there are more ticks, mosquitoes, and disease-carrying critters in our own backyards than ever before. It's kind of stressful, right? Well, it turns out you're not alone. Your favorite lake is also being stressed. Higher dew points are increasing water temperatures, and this promotes the growth of algae, which isn't fun to swim in and can be bad for your pets. Bottom line, when you're thinking about climate change, it's not just polar bears and penguins. It's about pollen, mosquitoes, and your very own dog right here in Minnesota. And that makes it much harder to ignore. So let's keep learning.
Welcome back. We're talking about climate change and its impact on public health with Dr. Mark Seeley from the University of Minnesota and Kristin Raab, Director of the Climate and Health Program at the Minnesota Department of Health. We talked about heat as part of that. You know, people think about global warming and climate change. That's the term that most people use. But we also know that we've had more water events, a lot, you know, rain, massive flooding, particularly in Minnesota, and then we have long periods of drought. So what's going on with the moisture? Dr. Seeley, that's sort of your area. What are we seeing?
We talk about this in terms of two perspectives. One is a quantity shift, strictly a quantity shift. Most places in the state of Minnesota now have average annual precipitation that is greater than what they've had historically. So the number is a greater number. Embedded in that signal, though, is an important character change in that precipitation, and that is that a larger and larger fraction of that annual precipitation is coming in very intense events, extreme events, as you've already said.
Okay. And I think we have a slide that shows that Minnesota is sort of at the, you know, critical point in some of that.
That's right. The Great Lakes region is one of the geographies that shows this very strongly in the records, and so we're having these horrific flash flood events with a greater frequency. Also, I might add that their total aerial coverage, the area of the Minnesota landscape that they cover, is a larger area than what we've observed historically. And these are very devastating because when we get large quantities of precipitation like this, they can tend to be very destructive in terms of the physical attributes of our landscape, but then also they're very disruptive and threatening in terms of public health considerations. And that's what we're seeing an increase of, and that concerns us quite a bit now, all across the region. We've had single-day rainfalls in Minnesota in recent decades that have been up to 15 to 16 inches of rainfall.
Wow. So, Kristin, what are concerns that you have when you see this, as Dr. Seeley was talking about, the impact that it has on people?
Sure. So because we're seeing more of these extreme rain events, we're also seeing more people that are having damages to their homes or injuries from the flooding. And you know, when we think about public health and we think about things like flooding, we immediately think of things like, well, maybe drownings from those extreme events or injuries, but it also has these long-term impacts on people. So your business is destroyed or your home is contaminated with flood water, and then you get mold growing in your home. So people with allergies and asthma may be exposed to that mold. There's also mental health stress if you've lost like your property, or you're having financial difficulty kind of recovering from that storm. There's sort of these downstream impacts as well. So not only are we interested in those immediate health impacts of being exposed to those floodwaters, but those aftermath effects that can last a really long time.
So how do we prepare for these things, both from a climatological perspective, but also from a public health perspective, knowing that this is not something that's going to change rapidly in terms of getting better? What should people do to kind of respond to the climate change? What can we do to mitigate these changes from an environmental standpoint?
Well, part of the coping mechanism that we're trying to encourage statewide is to use the latest information, so that in that context we now widely educate the public about the new National Oceanic and Atmospheric Administration, what we call Atlas 14, which is the return period calculations for these intense rainfalls, because we should use the most up-to-date data that we have, especially when it comes to the design of drainage systems, be it storm sewer runoff systems or agricultural drainage, the management of our watersheds, because the flow volume on our watersheds is becoming more erratic, or what we call more highly variable, both low flows and high flows. And so we need to adjust our management to the new climate. And a lot of that is being done, but still requires more educational effort, I think, to expand that.
Right. Well, it'll take a lot of resources too, I would suspect. I mean, these systems that we have in place, you know, sewage systems, they were put in 150 years ago. To replace those and update those would be massive.
Absolutely. And then exposures of infrastructure on our floodplain landscapes, where we have water treatment plants, where we have say feedlots in agriculture and other kinds of things. There's been changes over time in those exposures as well, because those floodplains are more frequently flooding now in the modern era, and of course that presents a threat of pollution and contamination. So there's all kinds of things going on in that arena in adjusting to what the new climate signature is. And we still have to pay careful attention to that. We don't know what the future is going to bring us, but we're migrating in a direction this is going to become more and more problematic.
And from the public health side, how do we prepare for some of these things?
So taking extreme heat, for example, there's things we can do from the public health side, making sure that we have a good warning system to warn people that we're experiencing an extreme heat event. But also there are things that you can do at home, like take a cold shower, or important things like checking on vulnerable populations, say calling your grandparents and seeing how they're doing. Are they turning on the air conditioning? Providing services to people that may not have air conditioning, maybe providing transportation so they can get to a place where they can cool off. So there's a number of different kinds of public health interventions that we can use to kind of protect people from heat, as an example.
And I know that not everybody is equally at risk. There are some populations that are more at risk than others, and I want to talk about those disparity issues in the next segment, but first we need to take another break. We'll be back right after this message.
When we learn about climate change, a lot of us have the same reaction. We want to make it stop. So what can you do right now today to help solve the problem? According to the experts, one way to reduce carbon emissions is to change your own behavior. For example, how many car and airplane trips do you and your family take every year? Is there any way you can reduce that number? Maybe by just 1 or 2 or even 3 trips? Can you do even more? Maybe you can walk, ride a bike, carpool, or jump on a bus. Now, leaving your car at home may feel inconvenient, but it does make a difference, because every time you shut off a car, or a lawnmower, or even a light bulb, it stops a small amount of carbon dioxide from entering the atmosphere. You can also make a difference by paying attention to the food you eat. You see, the more a food is processed, packaged, and shipped, the more carbon it takes to reach your stomach. So maybe you'd like to try some gardening, right in your own yard. After all, a lot of people find it really fun, and maybe you will too. And how about those lakes? One good way to stop the green slime is to keep things like grass clippings and leaves out of the water. This type of plant matter is literally what the algae eat, and every time we dump this stuff into a lake or a river, we make things even slimier. Beyond all these ideas, you can also turn down your thermostat, unplug unused appliances, and insulate your house for the winter. The trick is to have fun and to be creative. If one approach isn't for you, try another, or make up your own. Now, to be fair, none of these things all by themselves are going to stop climate change. But when you modify your own behavior, it can make an impression on your friends and neighbors, and that's an important step. Because if we are really going to solve this, we need to be innovative, and we need to work together.
Welcome back. We're talking about climate change and its impact on public health with Kristin Raab from the Minnesota Department of Health and Dr. Mark Seeley from the University of Minnesota. Said we're going to talk about disparities, but before we get to that, I want to talk about ticks. Because I understand, because of the changing climate and some of the things you talked about, Dr. Seeley, about the expanding range of flora and fauna, that ticks are expanding and that has an impact. Tell us what's going on with these little critters.
Yeah, with the particularly the temperature change and the change in the character of the seasons, certain environments now are able to serve as host for biological organisms, be they ticks or other insects that now can live in a wider range of geography across our state. And this is happening all over. This isn't just unique to Minnesota, but this is partially one of the reasons why we've opened in recent years the new Invasive Species Research Center at the University of Minnesota. Because as the climate changes, niches are opening up all over the place that now are more suitable environments for a wide variety of biological organisms. And we have to be on the alert for this and what's going to happen and how it's going to transform our natural environment, what exposures and how those are going to change. So ticks is just one aspect of this whole puzzle, but we're going to have to pay careful attention to it.
And Kristin, how are you paying attention to it? What are the risks that this brings?
Yeah, well, the Minnesota Department of Health has a great program around vector-borne diseases, and they have been documenting cases of Lyme disease and other diseases that ticks carry for a long time, since the 80s, and they have documented a spread of vector-borne diseases both northward and westward in Minnesota. And there are a lot of reasons for that expansion, but climate change is one of them. And again, ticks carry a lot of different kinds of diseases like Lyme, human anaplasmosis, babiosis. So that's something that we're going to want to track and monitor, and then provide people good public health information about how to prevent getting a tick-borne disease.
All right. So let's briefly talk about disparities. Who's most impacted? I suspect the people with lots of money, living in really good, stable neighborhoods and higher elevations really aren't at the same level of risk as a lot of others. Kristin, who are the people who are really at risk for climate change?
It kind of varies on what the issue is. So, for example, for extreme heat, some of the people that are most vulnerable to that are older adults, younger children, because their biology doesn't allow them to adapt as well to the heat. But people that are poor, for example, are more susceptible because they may not have air conditioners, or they may not be able to turn their air conditioner on to stay cool because they can't afford those payments. They may be in an unsafe neighborhood where they don't feel like they can open their windows and get some cool air. So it does, depending on what those issues are, it depends, who might be most vulnerable. But for flooding, for example, older people again are more vulnerable, but so are people that do not have resources to maybe evacuate, or they don't have enough resources to take care of basic needs if they leave their home. One of the things that we also look at is whether or not they have a car. Are they mobile? Can they move if there's an issue? And language can sometimes be a barrier. So if you don't speak English very well, you may not be getting the messages that you need to get to stay safe. So there are significant vulnerabilities within our communities that we want to be aware of. And one of the things that the health department is doing is trying to identify where those communities are. So we've done a lot of work with local public health and different kinds of communities to identify where are those populations, and what kinds of resources do they have, and what kinds of resources can we bring to help them prepare for these kinds of events.
Dr. Seeley, you were talking about some of the mitigation factors in terms of, sort of our community plumbing. Are people looking at, are some populations more at risk, and therefore some of our investments should be in those areas first? Any kind of talk about that?
Even within our own Minnesota landscape, we have disparity in terms of the threats, the exposures, and then the ability to cope in a resilient way with these changes. We have differences in the county units of government and what their resources are, individual municipalities and cities. But community by community, we see a lot more attention being paid to this. And they are beginning to see we're going to have to allocate resources. We're going to have to do it. We're going to have to approach it differently. And that's really good to see, because we're all linked, all our watersheds across the state of Minnesota, with different amounts of exposures and threats to this flash flooding. They're all linked. Upstream communities are linked to downstream communities and things like this. So we all need to be in this together. And it's really encouraging to see so many cities and municipalities now giving attention to planning around, with these threats in play, how do we become more resilient? There's lots more widespread discussion about this than there's ever been in history.
Good. And Kristin, from a public health standpoint, what are you telling people? How can they prepare? What should they be doing, given the fact that we have this change that's going on in our climate?
Yes, well, the health department has a lot of resources on our website, so I really encourage you to check out our website. But I also would encourage you to talk with your legislators and your businesses about climate change, because there's some policies and system changes that we really need to make. We can do things individually, we can get out of our car, we can drive less, we can walk more, be more physically fit, reduce those greenhouse gas emissions, but it's really going to take some significant policy changes to make a significant impact. And so I would really encourage people, if you're concerned about this, you're concerned about your health and those impacts of climate change, then talk to those people, talk to the businesses, and we can have a real community spirit engagement around both mitigating climate change, but then also adapting to climate change.
And actually, I know there's been controversy around this, but I get a sense that people are starting to recognize that we need to do something. Are you seeing that there is some convergence about thought that this is a public health issue or a issue that we have to address?
Yes, in fact, in my 37 years doing this around the state of Minnesota, I think convergence is a good word. I think all our different constituencies, all the facets of our economy, our economic engine, all the facets of our communities in Minnesota are coming to see this as a very important issue of their lifetime and giving it deservedly a lot more attention than it used to get.
Great. Well, this has been very helpful. Thanks to both of you for being here for this
Thank you.
important public health issue.
You're welcome.
And I'll be back with a closing comment right after this message.
Oh, look, a redhead. Staring contest. You still got it. I know.
Come alive with the forest.
The dad was cute.
You were looking right at us.
Visit discovertheforest.org to find a forest near you.
While healthcare is important, it's not the greatest determinant of health. The greatest determinants are the social and physical environments in which we live, learn, work, and play. They are the policies and conditions that affect our individual health but are beyond our individual control. Climate change is one of those determinants. Climate change is threatening the basic life systems on which we depend: our water, food, air, and shelter. Health effects related to climate change include death, illness, and injuries from heat waves, air pollution, water shortage, and an expanding range of infectious vectors. We are learning that climate change is not just an environmental issue, but a health issue as well. Beyond that, it is also an equity issue, because while climate change affects everyone, the effects of climate change will not be evenly distributed. The poor, the elderly, the ill, and the disabled, and those living in disadvantaged communities will be most affected. That's why we not only need to bolster our public health infrastructure to effectively respond to climate change, but we also need to address the numerous social determinants of health that already put people at risk for poor health. One thing that the social and environmental determinants of health and health equity have in common is that improving these factors will require the involvement of all sectors of our society. They will require personal action, but mostly they will require major social and environmental policy and system changes with a focus on equity. This is the work of public health, because as the Institute of Medicine said, public health is what we, as a society, do collectively to assure the conditions in which all people can be healthy. Climate change and equity are two of the most important conditions. That's why all of us have to have a public health perspective and be actively engaged in acting collectively to create the conditions that protect and improve our overall health and well-being. The future of our planet and all its inhabitants depend on it. That's all for today. Thanks for watching. I hope you can join us again next time on A Public Health Journal.